Welcome to Hemodynamic Monitoring Part 2. This is video 3 of our hemodynamic monitoring equipment. And in this video, we're going to be going over our PA lines, or our pulmonary arterial lines. So let's jump right into this. We're going to start at the bottom of this activity to tell the difference between our PA lines and our central lines. So what is the difference between these two lines and what conditions do they help monitor? Well, if we take a look, this line here on the right, this is the ending of a central line, and it can be utilized for medication administration, taking labs, blood gases, and giving medications that are more vesicant, and they're typically multiple ports. So now if we take a look here on the left-hand side, we'll notice that this catheter ends at a completely different location. So this is going to be our PA line, and this can be utilized for our pulmonary arterial pressures, our pulmonary wedge pressures, and it's really helpful when it comes to monitoring our fluid volume hemodynamics. So these lines are actually what we consider a Swan-Ganz catheter, and there are so many functions of a Swan-Ganz catheter. But in this video, we're going to keep it pretty basic. And so we're going to do a quick anatomy of our Swan-Ganz catheter. So this PAC, or pulmonary arterial catheter, or PA line, or Swan-Ganz catheter, is this little guy right here in yellow. And we can see that we have 4 additional lumens, and these are going to be the main lumens, but there are many other lumens and functions that can be available, but for this video, to keep it simple, we're just going to go over these 4. So this first lumen is going to be our white proximal infusion port. And this port's actually going to end right here in our SVC, or the right atrium. And this is just like our central line would typically end. But this is actually going to end 31 centimeters away from the tip of the catheter. So we're going to use this port to infuse fluids or give medications just like we would as a central line. And our next port is going to be our blue right atrial pressure port. We use this port just like transducing an arterial line. So this one we're going to transduce. So this is going to end 30 centimeters away from the tip. So it ends right here in this right atrium. It can potentially end in the superior vena cava, but this is just like our CVP line. It's that indirect measurement of our right preload. So this blue tip, we'll think right arterial pressure, or we can think of this as our CVP type of line. Then we have our PA distal lumen, our pulmonary arterial distal lumen. This is going to be at the very tip of our PA line, and we're also going to transduce this one as well. This is going to give us that pressure of the pulmonary arterial pressure. So as you can see, the tip of this catheter is ending in the pulmonary artery, or in that branch. So if we come back to our activity here and we see our pulmonary arterial pressure, this is that measurement of the pulmonary artery once it receives blood from the right ventricle during contraction. So we can think of this as the blood pressure within the pulmonary artery. And our normal range is going to be a systolic of 15 to 30 and a diastolic of 8 to 15. If you remember from the previous video, we briefly talked about the SVO2, or that mixed venous oxygen saturation. So this is going to be that port that we can pool our sample for this SVO2 blood gas. The next lumen is going to be our red balloon port, and this is going to have a custom syringe attached to it. So this balloon only holds 1.5 mLs of air inside it, and the custom syringe has 3 mLs of air inside of it. So it actually has this mechanism that it only allows you to push in 1.5 mLs of air, and you can only pull out 1.5 mLs of air of what that balloon is. So this balloon being inflated is going to help the provider coast it through the heart and into this branch. However, it's so important to know that if this balloon continues to be inflated, it can actually cut off blood flow completely. So it's important that this balloon stays deflated. However, We can also utilize blowing up this balloon to measure other pressures. And taking a measurement with this balloon inflated quickly is going to be our pulmonary wedge pressure, that PWP. So this is when we inflate that balloon within the small pulmonary arterial branch, and it's used to measure the left arterial pressure. This is going to be the gold standard to measure and diagnose left ventricular failure. This also can help us with mitral valve stenosis, any regurgitation, or pulmonary edema present. And we like to see a range of this between 4 and 12. If we see a wedge pressure greater than 20, then we do consider this acute pulmonary edema. And our last question, what is the difference between a central line and a PA line? So PA lines are specifically used for measuring pressures within the heart and the lungs. They're placed in that pulmonary artery. And central lines are going to be for administering medications, lab draws, and they are placed in large veins. We did learn about how we can still utilize these PA lines as central lines. All of this is going to be specific to your facility and the type of catheter that you are using. So before we go, we're going to match the following terms. You're welcome to pause this video and try this out yourself, or you can go ahead and play the video to see the following answers, although you can find all of this on the last 6 pages we went over. This concludes our lessons on advanced hemodynamics and hemodynamic monitoring, and I will see you guys in the next lesson.